But first, Victoria. It has completely stuffed up the whole country's recovery from the coronavirus panic. New infections each day in Victoria keep rising. Another 75 cases today, the most in 3 months. And you compare that to New South Wales, just 7 infections today, all from overseas travellers in quarantine, so that's safe. But Victoria, unbelievable how it's absolutely bungled it, and that's now hurt everyone. Its mismanagement has now stopped states like Queensland and South Australia, Western Australia from opening up their borders to tourists. In fact, Queensland has now said to the AFL, forget about sending more Victorian teams up there. That stops now. Far too dangerous. Which means the AFL has had to drop plans to send Richmond to play West Coast in Queensland on Thursday. They'll have to play in Sydney instead, if even that is now allowed. And Victoria had the toughest virus laws in the country, is now wondering, oh, what do we do now? Does it go back to that devastating lockdown that absolutely smashed the economy? Well, it seems no, the public's completely over that, so there'd probably be a revolt. So the government may just lock down some of the 10 hotspot suburbs, mainly in Melbourne's north and southeast. And the Prime Minister won't be against that at all.
Well, the Premier in Victoria has flagged that that is an option. The Premier and I are very adamant that we do what is necessary to contain this outbreak. Now, Victoria will lead that approach and they will be the final arbiter of what steps they take. But we can leave no stone unturned.
So, how on earth did it get to this? Well, Victoria's Health Minister today found someone new to blame. It wasn't the multicultural mess where immigrant families couldn't or wouldn't hear the health messages that have been translated into 53 languages and ignored in about half of them. I don't know. No. And nor was it the end of the Ramadan parties that helped to spread the virus. This government doesn't want to talk about that at all. And it certainly wasn't blaming itself. God, no. It chose instead to blame younger people generally. That's much easier.
We're seeing more young people getting together with their mates, contracting this virus, and then taking it home to their families.
Well, Minister, who exactly sent that demographic the message that it was fine to go out again? Answer, it was this same Victorian government which told Black Lives Matter protesters a few weeks ago that don't worry, if you go to this big protest, if you break all the social distancing rules, police will not pull you out of the crowd and give you an infringement notice. They will not fine you. Well, after that, who could take those social distancing laws seriously? But, in fact, it's worse than that. This outbreak is a 3 strikes and you're out clown show by the Andrews government. I mean, strike one. They got private security guards, amateurs, to staff the hotels where we keep returning travellers in quarantine. No surprise. Some got infected, don't ask how, brought it home. Strike two. The government didn't make absolutely sure that sick people supposed to be in home quarantine, including the guards, actually stayed there. Didn't invite in visitors. What do you know? Big surprise. Again, some broke the rules. Third strike. The government didn't even insist. This bit is the craziest. The government did not even insist that any returning traveller from overseas who wanted to leave their hotel quarantine first got a virus test to clear them. Incredible. 1/3 of those travellers leaving quarantine said, no test for us, please. We don't want this thing stuck up our nose. And the government said, oh, OK, whatever. You can leave anyway. There's the door. The government didn't do the absolute basics. Instead, it was doing this useless, hairy-chested stuff. Useless stuff. Like banning golf, banning fishing. You couldn't go surfing out where there's not a single virus on the waves. That was banned. But all that is one issue. The other is, how frightened should we now be? Now, clearly, the news in Victoria is not good. It threatens the rest of the country. I mean, this is a nasty virus. can kill. Yet, even now, perspective, even now, only one Victorian has died from this virus in the past month. A man in his 80s. We're not even told what other conditions he might have had. Just 7 Victorians, even now, are in hospital, and only 1 is in intensive care. And who knows? Who knows how much of this spike in Victoria is actually caused by the massive testing being done in that state of people who didn't even know they were sick and may never have known until they stopped for a test. A third of the latest cases come from routine tests. I'd like to see that repeated in other states, see what turns up. What's more, I would suggest that what we now hear from Britain this week is true here too. In Britain, an Oxford University study shows the chances of infected people dying there from the virus are a quarter of what they were at the start of this pandemic. So it seems, early detection, get care sooner, better drugs, better treatment, less clumsy use of those ventilators, more lives being saved. Now, we could be at that stage too. I don't know. Remarkable, so few people in hospital in Victoria. So I would say that we now need even more to consider what I've been trying to suggest for months. This virus is not likely to stop being a problem for a long time. And we can't all just hide from it in our houses, stop working until a vaccine is discovered. You look what's happened to the economy already. And by the way, you look at all the people the government now blames in Victoria for being out and about and spreading this stuff. They've had it with those controls, absolutely had it. So we need instead to do the obvious, how to live with this virus. Tougher quarantining of the sick. How often have I said that? And tougher protection of the people most likely to die, people over 70 years old. More than half the dead, 80 or older. So let's try something sane, something targeted and not so horrendously expensive. Less panic, more brain.